Now we've shown this unfortunate guy behind Merlin accidentally getting shocked. Merlin was trying to fight the tall man on the dragon, but he didn't notice that an innocent citizen was behind him. We've shown this guy getting shocked to help you remember the final toxin-mediated disease of Staph aureus, which is toxic shock syndrome. So guy getting shocked for toxic shock syndrome. Let's zoom up on this guy and discuss this in a bit more detail. First, notice that he's wearing a cape. Many superheroes wear capes, so this seemed like a fitting symbol for superantigen. Toxic shock syndrome toxin 1, or TSST1, is a superantigen which causes binding of MHC class II and T cell receptors, resulting in overactivation of T cells. This in turn can result in an overwhelming release of cytokines, which is clinically manifested as shock. So superhero-like cape for superantigen. Toxic shock syndrome is classically associated with prolonged use of a tampon or nasal packing. To help you remember this, we've shown this guy with a tissue jammed up in his nose. The electricity immediately tensed up his entire body, causing him to vomit. The vomit should help you remember that toxic shock syndrome may cause vomiting. Clearly, this person is getting shocked, as should hopefully be apparent by all of the electricity and the name of this toxin-mediated disease. So hopefully you're not too shocked that toxic shock syndrome causes shock. From pathophysiology, you should recall that shock is characterized by decreased perfusion to the tissues, so many organs may experience damage during an episode of shock. For example, the liver will be damaged, resulting in increased AST and ALT. The rise in AST and ALT, as well as other common sense lab abnormalities, haven't been included in this image because this should hopefully be pretty obvious if you understand the pathophysiology. So, guy getting shocked for shock. Next, if you look closely on this guy's arm, you can see a bunch of little red spots with some skin falling off. This is to help you remember that toxic shock syndrome can also cause a desquamating rash. Okay, that's everything you need to know about the toxin-mediated diseases. Now let's discuss the inflammatory diseases.